Let's explore some examples of viral diseases, including their causes, signs and symptoms, incubation periods, and common treatments. Chickenpox was a common childhood disease that has largely been reduced in the United States due to the vaccination that was released in 1995. It is caused by the varicella-zoster virus. Signs and symptoms include a fever, flu-like aches, and a rash characterized by red fluid-filled blisters. The incubation period is anywhere from 10 to 21 days, so it does spread very easily, as people may have been spreading the disease for up to 3 weeks without symptoms. It is spread through direct contact, droplet, and airborne transmission methods. As this is a virus, antibiotics will not be effective here. The best treatment is to receive the vaccine and to not get the disease in the first place. If that was not effective, then it should resolve on its own, and the patient can use anti-itch treatments such as lotions and oatmeal baths to alleviate this often pesky symptom. The patient is to be isolated until the blisters have crusted over to prevent spreading the disease anymore. The flu or influenza is caused by the influenza virus. Signs and symptoms include fever, body aches, sore throat, and coughing. The incubation period is very short at only 1 to 4 days. The flu is transmitted from the coughing and sneezing and the droplets of the respiratory system and can remain airborne. As the flu is a virus, antibiotics will not work here. There are some antiviral medications, but are safe for severe cases of the flu and must be started within 3 days of the start of symptoms to be effective. Other treatments include rest, warm fluids, and over-the-counter medications. Hepatitis B is a viral infection that affects the liver. Signs and symptoms include jaundice or yellowing of the skin, abdominal pain, dark urine or stool, joint pain, and fatigue. The incubation period on hepatitis B is between 6 weeks and 6 months, meaning you could have been infected several months earlier from your first symptoms. The mode of transmission for hepatitis B is through blood product and sexual contact, as well as passing perinatally to infants from their mother from being pregnant, childbirth, or breastfeeding. Hepatitis B can be acute, or short-term or chronic, more long-term. There is a vaccine for hepatitis B, and this is the best way to prevent the spread of this disease. Antiviral medications can be helpful for treatment as well. Measles is another disease that is not seen as much in the United States after the introduction of the MMR vaccine. Measles is spread through a virus. The signs and symptoms include a high fever, flu-like symptoms, with a flat rash that is red to slightly brown starting on the face and chest. The average incubation period is 10-12 days. Measles is transmitted by droplets and can be airborne. The patient should remain home in isolation until the rash associated with measles disappears. The best treatment is to get the MMR vaccine, and as this is a virus, antibiotics are not useful here. You have to wait for it to run its course.